In one day, approximately 20 liters of fluid is moved from the capillaries into the interstitial space. On the venous end, 17 of those 20 liters are reabsorbed primarily by osmotic pressure of the plasma proteins within the capillary system. However, there is a net loss of 3 liters to the interstitial space. If there is no way to return these 3 liters back to the cardiovascular system, we would be in trouble by the end of the day. This is because the blood total is only 5 liters and a plasma volume of only 2.75 liters. If this fluid was not returned, our blood volume would decrease, which would decrease our end diastolic volume in our ventricles, which would result in a smaller stroke volume. How is this 3 liters of fluid eventually returned to the cardiovascular system? As blood moves from the arterioles into the capillaries, there's an extensive branching to increase the surface area of the capillaries. Intertwined within the capillaries is the lymphatic system. The lymphatic system serves as an immune defense by providing a pathway for lymphocytes to travel throughout the body. The lymphatic system also is able to pick up the interstitial fluid that is not reabsorbed back into the capillaries. The lymphatic system then carries this lymph back to the right atrium, where it is able to re-enter into the cardiovascular system. Lymph vessels are composed of a single sheet of endothelial tissue. The endothelial cells are arranged in an overlapping arrangement similar to shingles on a roof. This overlapping arrangement allows interstitial fluid to enter into the lymphatic system if pressure is great enough. As pressure increases in the interstitial space due to more fluid leaving the capillary systems, this pressure exerts a force on the lymphatic vessel and forces the fluid into the lymphatic system. The cross-sectional view of the lymphatic system shows what would happen if there is an increase in interstitial fluid within the body. This would happen if somebody became overhydrated. If there's an increase of plasma volume, more plasma would be forced out of the capillaries on the arterial end due to an increase in capillary pressure. This would result in more fluid being left in the interstitial space. The interstitial fluid would then exert this increased pressure on the lymphatic system and force this fluid into the lymph vessels. This is indicated by the larger arrows on the cross-sectional view. In contrast, when pressure is dropped, as would be the case if someone was dehydrated or experiencing a blood hemorrhage, capillary pressure would drop and there would be greater reabsorption on the venous end. This would lead to less fluid being left in the interstitial space. Less pressure would be exerted on the lymphatic vessels, and less fluid would enter into the lymph. This is how the lymphatic system helps to regulate and maintain appropriate interstitial fluid and help maintain total plasma volume within the capillary system. The lymphatic system serves many specialty roles. Not only does it return plasma volume lost to the interstitial space, it also can return plasma proteins which cannot re-enter via reabsorption at the capillary level because of their large size. During bulk flow, some plasma proteins do exit the capillaries. If we were unable to return these plasma proteins back into the cardiovascular system, osmotic pressure within the capillaries would decrease compared to the interstitial fluid. As time passed, more plasma proteins would be pushed out of the capillaries through bulk flow, which would leave less plasma proteins within the plasma. These would decrease the gradient between the interstitial fluid and the capillaries and lead to less reabsorption back into the capillaries. The lymphatic system is also able to transport digestive fats into the cardiovascular system. Digestive fats are too large to be transported between our small intestine and into the capillary system. Digestive fats are packaged and moved into the interstitial space between the small intestine and the capillaries, and then are picked up by the lymphatic system and delivered to the right atrium, where they then can enter into the bloodstream. The lymphatic system also contains lymph nodes, which act as special filters to monitor and cleanse the blood. This ensures that all the blood remains similarly composed. Edema results if there is an increased ability of the body to return interstitial fluid back into the cardiovascular system. This can be caused by a change in plasma protein concentration, either an increase in the interstitial fluid or a decrease of plasma proteins within the blood, by an increase of pressure at the capillaries, leading to more fluid being pushed out of the capillaries, or an increase in permeability of the capillaries, or an increase in venous pressure, which would lead to less of a pressure drop between the arterial and venous side, and more fluid being forced out of the capillaries. Edema in small quantities is not a concern. Eventually, our body rids itself of this excess edema over time. However, edema in uncontrolled situations can result in a concern. Edema is problematic because it allows for a fluid buildup within an area of tissue. It results in a decrease of plasma volume within the cardiovascular system, which can lead to a decrease of cardiac output, and it can also decrease diffusion between the capillaries and the other tissue, because the increased volume leads to an increased distance for nutrients and waste to diffuse through. As the distance increases and diffusion decreases, it is more and more likely that the cells in that area will die. Arterioles are our pressure reservoir. They have a large amount of elastin, which causes them to recoil when they expand due to systole. Arterioles, on the other hand, have an increase in smooth muscle and sympathetic innervation. This allows the arterioles to be the main source of resistance within the body to allow for adequate pressure gradients to occur. Veins have an increased amount of collagen and a decreased amount of elastin, which allows them to expand and hold excess blood. The decrease of elastin causes them to be able to expand without exerting a pressure back onto the blood. This becomes helpful when we think of Frank Starling's law. The larger the venous return, the greater the stroke volume, the greater the cardiac output. During resting conditions, we do not need a large cardiac output. Therefore, the ability of veins to be able to expand to hold some of our blood volume allows us to match our cardiac needs. The veins can hold on to excess blood volume to decrease venous return so that cardiac output matches the needs of the body. This helps us maintain a lower resting heart rate and put less stress on our heart. During rest, the veins hold about 60% of our total blood volume. This reserve also allows us to expand cardiac output as metabolic demands increases. As metabolic demands increase, the veins can continually decrease the amount of blood that they hold to allow for greater venous return for a greater cardiac output. How do we increase venous return when the body's metabolic needs increase to require a larger cardiac output. Blood flow is a change of pressure over resistance. By the time the blood reaches the veins, it has a fairly low pressure of 17 millimeters of mercury. However, there is still a pressure gradient because the right atrium has a pressure of about 0 millimeters of mercury. Any way that we are able to increase venous pressure or exert a squeezing effect on the veins, we would be able to increase this pressure gradient. One way to increase venous return is that veins have a smooth muscle lining around them. The smooth muscle is innervated by sympathetic neurons, which when activated result in a vasoconstriction on the vessel. When an increase in venous return is needed to meet cardiac output demands, there is an increase in sympathetic stimulation. This increase results in a vasoconstriction of the vein. This vasoconstriction increases blood pressure and increases blood flow back to the heart. The arterioles act by decreasing the amount of blood that is allowed into the system. By decreasing the amount allowed into the system, it acts as a dam, which creates an increased pressure in front of the arterioles. Vasoconstriction of the arteriole decreases blood flow into that arteriole. This acts as a dam by holding more blood upstream and thereby increasing upstream pressure. In the venous end, the decrease in radii due to vasoconstriction is not significant enough. The small amount of vasoconstriction that occurs increases blood flow back to the heart because it decreases the capacitance or the ability to expand of the vessels. Another way in which venous return is increased is through the activity of skeletal muscle. All veins are surrounded by some sort of skeletal muscle. As our muscle contracts, this increases the pressure exerted on the veins, again decreasing its capacitance, its ability to stretch, which increases pressure. As the skeletal muscle alternates between contraction and relaxation, it acts as a pump onto the vein by squeezing on that vein, which increases the pressure difference between that vein and the right atrium, and therefore increases blood flow. A great example of this is what we see when we don't have the skeletal muscle pump. It is not uncommon for soldiers during basic training to have to stand outside at attention for long periods of time. The longer they stand without activating that muscular pump, the more blood pools up in their feet. This pooling of blood at their feet decreases venous return, and eventually the brain does not receive sufficient oxygen. It causes the body to faint to reestablish blood flow to the brain. In the horizontal position, there needs to be less pressure to get the blood to move upwards towards the brain compared to while we are standing. Another factor to help increase venous return is the presence of vein valves. Vein valves help to decrease the impact of gravity. Without any vein valves, the blood would be able to move forward and backwards with little resistance to prevent backflow. The presence of vein valves allow that backwards blood flow to force the valve shut. The shutting of this valve creates small relief from the effect of gravity by decreasing the amount of blood in each section. The overall force of the full tube, if vein valves were not present, would be greater than by sectioning the vein up into smaller compartments, which is accomplished by the vein valves. Blood pressure is closely regulated within the body. The body regulates mean arterial pressure. The regulation of blood pressure is important to maintain blood flow throughout the body. There are two conflicting needs within the body. The first is that the brain and all other organs of the body receive adequate blood flow to maintain homeostasis. This is why the body needs to maintain a certain amount of blood pressure. In contrast to this, if the blood pressure becomes too high, it puts the heart under increasing workload demands, which can be detrimental to its own tissue survival. This is why we want to keep blood pressure as low as possible. The balance between adequate blood flow and avoiding cardiovascular damage is the reason why our body maintains blood pressure closely. Blood pressure is equal to cardiac output times total peripheral resistance. If we need to increase blood pressure, we can do this by either increasing cardiac output or total peripheral resistance. If we need to lower blood pressure, we can do this by decreasing cardiac output or total peripheral resistance. If our overall goal is to increase blood pressure, we would have to do this by changing cardiac output or increasing total peripheral resistance. Cardiac output is the combination of stroke volume and heart rate. In order to increase total peripheral resistance, we would want to decrease the radius, which would result in a vasoconstriction of arterioles and an increase in total peripheral resistance. The other way we could increase total peripheral resistance is by increasing blood viscosity. In order to increase blood pressure, we have to increase one or many of the following variables. We have to increase stroke volume, heart rate, or blood viscosity, or we have to decrease arterial radii. This can be accomplished by increasing sympathetic stimulation to the heart, which would increase heart rate and increase stroke volume. We could increase venous return, which would increase stroke volume. We could decrease muscle activity, which would result in vasoconstriction to local muscles, or we could increase systematically sympathetic stimulation to all arterioles, which would increase vasoconstriction. In order to increase blood viscosity, we could increase the number of red blood cells within the body. Increasing red blood cells would be a long-term fix to the issue. It would take some time to increase the amount of erythropoietin and red blood cell production by the red bone marrow. We could increase venous return through several methods. We could increase blood volume by increasing water and salt retention from the kidneys. We could increase respiration, which would increase the pressure gradient between the veins and the heart. We could increase sympathetic activity, which would cause less compliance within the veins, or we could increase skeletal muscle activity. We would not want to utilize the increase in skeletal muscle activity due to the fact that it would increase arterial radii by increasing the oxygen and metabolic demands of this tissue, which would induce vasodilation. The following would be the goals if we were looking to decrease somebody's blood pressure. Why would we prescribe increased exercise to someone we are looking to decrease their blood pressure? With exercise, we would see an increase in stroke volume, an increase in heart rate, an increase in arterial radii, and no change in blood viscosity or an increase in blood viscosity due to loss of plasma volume through sweat. All of this seems counterintuitive to trying to decrease somebody's blood pressure. These, in fact, look like things that would increase somebody's blood pressure. This is true. During exercise, we see an increase in cardiac output and an increase of blood pressure. However, shortly after exercise has ended, heart rate begins to decrease. However, the increase in arterial radii, which results in a decrease in total peripheral resistance, can be seen up to 24 hours after exercise. This means that 30 minutes of increased blood pressure and cardiac output could result in a decrease in blood pressure for up to 24 hours. This is why exercise is commonly prescribed as a way to decrease blood pressure long term. However, someone with hypertension should never engage in physical activity without first talking to their doctor. Blood pressure is measured by baroreceptors located in the carotid sinus and the aortic arch. These receptors are constantly informing the cardiovascular control center of blood pressure in both locations all the time. It does this by increasing or decreasing action potentials. If the baroreceptors detect an increase of blood pressure in the carotid sinus or the aortic arch, they are going to increase the number of action potentials they send to the cardiovascular control center. The cardiovascular control center will integrate this information and effectively increase sympathetic stimulation to all of its organs, which will decrease heart rate and decrease metabolic demand of most organs. It will also decrease sympathetic stimulation to the arterioles, which will result in an increase of arterial radii and a decrease in resistance. The net effect of a decrease in heart rate, a decrease in metabolic demand, and a decrease in arterial resistance will decrease blood pressure felt by the baroreceptors in the carotid sinus. This will then allow it to decrease action potentials to the cardiovascular system to inform it that it has now entered back into homeostasis. If a decrease in blood pressure is felt in the carotid sinus or the aortic arch, the opposite will occur. There will be a decrease in action potentials to the cardiovascular control center to inform it of the decreasing blood pressure. It will therefore increase sympathetic stimulation to the heart, which will increase heart rate and stroke volume. It will decrease parasympathetic stimulation to other organs and increase sympathetic stimulation to the arterioles, increasing its resistance through increased vasoconstriction. These will act to increase blood pressure, which will then be detected by the baroreceptors